So I hope most of the participants already participated in the training which we conducted earlier. So this session will be like a refresher training, which asked by Dr. Srihari sir to provide the refresher training, which helps us to do the screening in the field, as we haven't done any frequent or daily screening in the field because of the COVID situation. Now we are in the exact time and also exact uh, uh, this one to start the field operations, because the COVID situation is now it is coming to normal slowly and gradually. So I'm going to start with clinical and disease part, which includes the which includes the middle ear, outer ear, and inner ear. That in the sense, the exact what are all the parts in ear, and what are all the problems, or what are all the diseases which is happening in the particular parts, and also what are all the remedies or medication solution for the particular problem. Then we are moving to device part, ENTraview device part, how we are going to handle the device in the field, how we can able to capture the picture of the tympanic membrane, and how we will analyze the tympanic membranes diseases, right? So let me quickly go to the anatomy part. So this is ear anatomy. Which contains the information regarding what are all the parts and how it is working, and what are all the diseases which is going to happen with the particular parts, and what are the diagnosis which we have to provide to the patient, those who are having the ear related issue. So I will give you a brief explanation about the three parts of the ear. Then we will do the deep dive one by one after this explanation. So we are having our ear is bifurcated into three parts. One is outer ear, then middle ear, then inner ear. So outer ear contains two parts, and inner ear contains each and every parts is containing their own parts, and each and every individual organ is having their own working this one. So we are going to look into that elaborately in the upcoming slides. First, I'm going to cover the outer ear. Outer ear contains pinna and auditory canal. So basically, pinna, everybody knows that you people are medical professionals, or some nurses, or audiologists. So this could be your refresher training. So better you can give some concentration in this. If there is any questions, then you can yes, as per Faisal say, you just note it down, and in the end of the session, at the end of the session, we can discuss about that. I will address all these queries, all your queries. So pinna and auditory canal is a part of outer ear. So pinna, basically we can see it physically with our eyes. So pinna, we are having some design in the pinna which helps to collect all the sounds which is in the atmospheric air, and it allows that sound inside the auditory canal. So once the pinna collected all the sounds, then it automatically travels via auditory canal, and it will reach the tympanic membrane, right? So So these two parts are in outer ear, and even we can consider our tympanic membrane. That means eardrum, we can say in a simple language. So tympanic membrane is like one part we can consider it is in outer ear and also middle ear, because it is bifurcating the outer ear and also middle ear. It is like a wall. We can see the tympanic membrane's image with the help of the ENTraview or otoscope, you can say. So these three parts are in outer ear. So once the pinna collected the sound and it travels via the auditory canal, it will reach the tympanic membrane and it will hit the eardrum. We can consider the drum, which we can see in like in temples, functions, everywhere. The skin part in that instrument, if we hit the skin part, it will start vibrating, right? So like the same kind of operation is function is going to happen here. Once the sound wave hits the tympanic membrane, then the tympanic membrane starts vibrating, right? So here you have to imagine the drum. Like as I already told you, we can see it in the festivals, right? So if that person hits the tympanic membrane with a stick, then the skin part will start vibrating. So this vibration will transfers to the middle ear. So middle ear consists of again two parts. One is tympanic membrane. We can consider that in outer ear and also middle ear. Then second one is ossicles. Ossicles in the sense, ossicles contains three tiny bones. In our body, and several number of bones are there, but these three bones are very tiny one. It's called individually, it is called malleus, incus, and stapes. So this malleus, incus, and stapes, all the three bones are interconnected together, and malleus bone is connected with the backside of the tympanic membrane. So we can see the impression of the malleus bone in the tympanic membrane. If we capture the image of tympanic membrane, you can see the handle of malleus. That the impression we used to call it as handle of malleus, right? So once the sound wave hits the tympanic membrane, then as I already told you, it starts vibrating. Then the vibration transmits to the malleus, because the malleus is connected with the tympanic membrane, backside of the tympanic membrane. So if anything connected with some vibration medium, then that thing also start vibrating. So the same thing happening here. So this malleus starts vibrating, then it transfers the vibration to incus. Incus is nothing but uh, uh, the connecting bone between malleus and stapes. Malleus is connecting with backside of the tympanic membrane, and stapes is connecting with inner ear, we can say now, inner ear. But these bones are connected by incus, that is a middle bone. So again, this vibration from transmitted from malleus will again transmit to stapes, because obviously it is also connected with stapes. Then stapes start vibrating, and now we can look into inner ear. Inner ear consists of again two parts. One is semicircular canal and cochlea, right? So this, as like malleus is connecting with tympanic membrane, stapes is connecting with semicircular canal. So semicircular canal and the cochlea both are filled up with a liquid or fluid. You can call it as liquid or fluid. So once the incus transmits the vibration to stapes, then the stapes also starts vibrating. It is connected, as I already told you, it is connected with snail. That means semicircular canal. It is filled up of fluid. So once the stapes start vibrating, it is like a stirrup thing. As you can consider one river. So if we throw the stone into the river or well, then the ripples will form, right? So kind of mechanism is happening here. So once the stapes start vibrating, it creates the waves inside the semicircular canal. Semicircular canal's fluid start it is like a wave kind of thing. We can call it as ripples. Then the ripples ripples start transferring to the cochlea. Cochlea is nothing but a snail-shaped structure. We can call it a CPU of main brain, we can say, for ear operations. So this cochlea contains again fluid and also hair cells. These waves are reaching to the tip of the end of the cochlea, and it returns back and it exit via the round window, which you can see it in the screen. So these are all the simple mechanism of the entire mechanism of ear. And anatomy contains again three parts. I already told you. I just briefed you. Now we are going to elaborate each and every part, and we will discuss about what are all the mechanism in detail, and also diseases and disorders after that treatment. So as I already told you, ear is having outer ear, middle ear, and inner ear parts. This is outer ear. Outer ear contains pinna and external auditory canal and tympanic membrane. Tympanic membrane, again I am telling you, we can consider it is in the outer ear and also middle ear, because front side we can see with the help of otoscope, and back side we can't see, but it is acting like a wall between outer ear and also middle ear. So middle ear consists of again two parts. One is ossicles. Ossicle contains three bones: malleus, incus, stapes. Malleus is connecting with backside of the tympanic membrane, and stapes is connecting with semicircular canal, and both bones are interconnected with the help of incus. So once the tympanic membrane start vibrating, it transmits to incus, and incus transmits the vibration to stapes. Then stapes starts stirring up the fluid which is in the semicircular canal. So inner ear consists of semicircular canal and cochlea. So see, this blue color thing is like you can consider this as water or fluid which is filled up inside the semicircular and cochlea. I will play you some video which helps you to understand very easily what is the exact working structure of the ear. So this helps us to understand very simply how the sound waves travels, and what are all the conversion forms, and where it reaches, and what are all the parts working procedure. So again, I will quickly brush up the exact working and also the conversion forms to you. So first, pinna and auditory canal. Pinna collects the sound, and auditory canal, via auditory canal the sound travels and it hits the tympanic membrane. The tympanic membrane starts vibrating. Here sound wave converted into vibration. So this is the first form of conversion. Then this vibration transmits to the ossicles. Ossicles is nothing but three bones: malleus, incus, stapes. Then this vibration transfers to semicircular canal. Semicircular canal and cochlea um, contains fluid. Then this vibration converted into like we can say waves or ripples. Then the ripples like it is traveling towards the tip of the cochlea, and it return back and it eject via oval window. So at the time the fluid we have to like here that ripples converted into electrical pulses or signals. Electrical pulses are signals. So that signals is transferred via auditory nerve to brain. So this is the exact working principle of our ear. So we are having tympanic membrane image in front of you. So I hope everyone is seeing the screen. So some part of the tympanic membrane is very much important, because with the help of this parts only, we can able to identify whether there is a problem with the tympanic membrane or not. And if there is some problem, then what is the severity of the problem, how we have to educate or counsel the people to get the treatment in the hospital. That's the thing which helps us to find out the exact problem of the patient. So here you can see, so a lot of parts are there, but we need only 4 parts here, which helps us to identify the things. One is handle of malleus, which I already explained you. It is connected backside the tympanic membrane. That is called handle of malleus. So once the tympanic membrane got vibrate, then it transfer to malleus. So that's the only thing. And second one is light reflection or cone of light, which you can see here. This is cone of light. This is handle of malleus. So you can ask me now, what is the purpose of these two? So once you capture the image, sometimes in field, our ear care counselor, some nurses or some staffs will definitely mistakenly mark it as right ear. If you capture left ear and they mark it as right ear, then confusion will happen. So at the time, once the data got uploaded in the web portal, then our manager have to cross check the details. At the time, if there is some mismatch in the captured picture and entered data, then we can change it. And moreover, sometime if we are doing work in field, then we can identify which one is left ear or right ear. But once we started doing the analysis in the web portal, we have to look or consider all these things, then only we can able to identify. So let me tell you, if the light reflex or cone of light and handle of malleus will be lying in the left side, so it is considered as a left ear drum. If the cone of light and the handle of malleus is lying in the right side, then it is right ear. So you can say it as 11 7 11 7 11 o'clock and 7 o'clock, it is left ear. And 1 o'clock 5 o'clock, it is right ear. So this is the way you have to remember the things, then only you can able to correct the things. Even after the field workers made some fault, you can able to do the corrections. So the third part is pars tensa. Pars tensa is here. This is pars tensa. So these parts are pars tensa. The inner skin part. You can imagine the skin of the instrument, the drums. The inside of the thing is called the pars tensa. So the fourth one is pars flaccida. Here, the outer layer. This outer layer is called pars flaccida. So now again you can imagine the drums. So the inner part is skin and outer part we use to stitch there for the tension. Then only we can able to create the sound, or we can use to play the music. So now you can ask me now, what is the purpose of pars tensa, knowing pars tensa and pars flaccida. So if there is any hole during, if you are, you can imagine that you are examining on a person, you are capturing on image of a tympanic membrane of a person, then you can find one hole which is in the tympanic membrane. So at the time, you have to identify whether the hole or whether the problem is severe or not. So for that purpose only, we can use this pars tensa and pars flaccida, which I will explain you in the upcoming slides during our diseases and disorders. I will explain you. what are all the purpose of pars tensa and pars flaccida. So these are all the four parts which you have to keep it in mind. It will help you to identify the or diagnose the problem with the person. So first one is handle of malleus, second one is cone of light, third one is pars tensa, and fourth one is pars flaccida. Please remember this. This will help you in the upcoming slides. This is eustachian tube. So eustachian tube is nothing but it is a connecting thing between our ear and nose. So each and every, like we can say that nose, ear and throat all are connected together. So here the connecting tube between these two, the ear and nose, is called eustachian tube. So it is connected the back side of the nose with the middle ear space of the ear, middle space of the ear. So this is the eustachian tube, you can say. This is also plays a vital role in hearing, and also the problem or the diseases of these are also happening going to happen in the eustachian tube. So till now we have seen the parts of the ear, and how the sound travels and what are all the forms the sound changed and how it reaches the auditory brain. And now we have to see, we are like we are going to look into the diseases and disorders. And the third one, after completing this, we are going to see the remedies or medication of the particular problem. So first one is again pinna. So pinna, we are having some abnormalities here. So each and every part is having their own disorders. Now we are looking into pinna, and in pinna, the undeveloped pinna like this. I hope you my screen is visible. This is undeveloped pinna. From by birth, it will be some people are having this kind of problems. The only solution for the problem is like plastic surgery or some reconstruction of the pinna. Doctor will suggest. So this is abnormal pinna, which we can easily identify with our ear. No need to use the instrumental, because it is clearly visible, right? Physically we can examine. So this is abnormal pinna. Apart from that, for normal pinna also, people are facing some disorders. First one is infection of the pinna. So each and every part of our human body is having skin. So wherever the skin is there, then infection will also be there. So irrespective of the parts. So in the entire ear anatomy, we are going to discuss about the infection in all the parts, but in different names. Here we can say that infection of pinna. So sometimes infection will be like we can easily identify with the color, the reddish color. Sometimes it will get swollen, like you can see in the picture. Then second one is ear hematoma. Hematoma is nothing but an injury. Like in a fight, you can see the boxers are kicking between themselves, and sometimes if it hits the pinna, then it will the pinna will like swollen. So that is also a problem. And the third one is very much important one. It is preauricular sinus. Preauricular in the sense, auricular in the sense our pinna. Preauricular, the before pinna. Before pinna, there is some small hole and also the reddishness. Sometimes the pus will come out, pus or water will come out from this hole. Sometimes it is like swelling and it will create so much pain. So it is called preauricular sinus. Now we can see what is the medication for this pinna. So infection, yes, everyone knows that for infection it is antibiotics. Doctor will provide some cream or some tablets for some period of time, then it will get reduced. Ear hematoma, again the tablets or medication will help to cure. Preauricular sinus, based on the severity of the preauricular sinus, the doctor will suggest medication, or sometimes it will leads to surgery. The surgery name is also called as preauricular sinus. So this is the major disorders or diseases which is related to pinna. So this I already explained you. So handle of malleus and cone of light, which is in the left side, that in the sense 11-7, it is called left ear, and 1 and 5, you can say 1 and 5, it is right ear. Now pinna, outer ear parts, we are having pinna and ear auditory canal. So we already discussed about the diseases and disorders of pinna. Now we are coming into ear canal disorders. Ear canal, the sound waves usually travels via this ear canal only, and it will reach the tympanic membrane. So this is normal ear. This is normal ear, and in ear canal we are facing foreign body. The disorders are foreign body and earwax and otitis externa. So these three are the major diseases or disorders in the ear auditory canal. So what is foreign body? Foreign body is nothing but any substances or any thing which is not related to the human body is called foreign body. You can consider an example of insects, sand, or small stones, or anything else which is not related to our human body. Then second one is earwax. Earwax, both two varieties of earwaxes are there. One is good wax and also bad wax. Good wax, no need to remove, no need to clean by ourselves. It will automatically come out by itself. So then second one is bad wax. Bad wax or impacted wax, we can say. So for that, we have to consult a doctor, and doctor will do some procedure or minor procedures to remove the impacted wax. That I will explain you in the upcoming slides. Third one, what is this externa? Again, I explained you in the previous slide. Wherever the skin is there, then infection is also will be there. Infection will be also there. So here also it is antibiotic. So infection we are calling here as what it is externa. In that pinna, that is simply called infection. So for infection, antibiotics is the only remedy. So foreign body, earwax, and otitis externa are the three other diseases and disorders which is happening in ear canal. So foreign body, wax infection, ear canal infection, and stenosis. Stenosis and congenital atresia. These two are rare scenarios, but we can have a glance of it also. Stenosis, narrowing of the canal. Narrowing in the sense, lack of narrowing in the sense there is no canal. Okay. Congenital atresia in the sense lack of canalization. There should not be a ear canal available in a person. That is a rare scenario by birth, as like I already told you in the pinna session. undeveloped pinna, or sometimes pinna is not available. Sometimes it is not developed completely. As like that, ear canal also we can face that congenital atresia. That means lack of canalization. So here we can look into the treatment of the parts, treatment of the problems which is in ear auditory canal. One is foreign body. Foreign body, syringing, drowning, probing, and microsection are the four ways to clean or treat the foreign body. So syringing is nothing but it is syringing. The name itself you can easily identify. Doctor will fill the syringe with the water, and he will forcefully inject in the ear auditory canal. Then it will come out. That foreign body will come out. Based on the foreign body, the doctor is going to decide what kind of procedure or minor procedure he can do. Drowning, like again the name in the sense you can easily identify. So doctor will fill the water in, say, in the ear auditory canal. Then that external particle will float and float on the top of the water. Doctor will clear that. Then probing, it is like doctor will use the tweezer kind of thing to remove the foreign body from ear auditory canal. Fourth one is microsection. Microsection is nothing but doctor is going to use the instrument which sucks the foreign body in the ear auditory canal. So these are all the four methods of removing the foreign body from ear auditory canal. Then wax, I already I explained you two kind of waxes are there. One is good wax, and another one is bad wax. Bad wax or impacted wax. So good wax, no need to clean or remove and all. It will get drained and came out from the ear auditory canal by itself. Second one is impacted wax. Impacted wax only created some problem with our hearing. So it will act as a wall between outer ear and also tympanic membrane. So it if the sound waves traveling via auditory canal, the 100% of the sound wave will not able to reach the tympanic membrane, because the wall like structure created by this impacted wax will not allow the 100% of sound traveling and reaches the tympanic membrane. So again here impacted wax classified into two. One is soft wax and hard wax. Second one is hard wax. Soft wax, once you visited the clinic for consultation, doctor will clean the wax from your soft wax from your ear with the help of these four: syringing, drowning, probing, microsection method, then and there. But if the wax, impacted wax, is hard enough to, like, if doctor can't able to remove that, then doctor will prescribe you some soften the ear wax. After 4-5 days of the medication, then doctor asked you to visit the clinic, and then doctor will clean that wax. Because if doctor tried to clean the hard wax, then it will definitely damage the ear auditory canal and sometimes tympanic membrane also. Then we have to soften that wax with the help of drops. Then only we can able to remove the wax. That is called hard wax, hard impacted wax. Then otitis externa. So this is again infection. That is antibiotics is the only solution for that otitis externa. So these are all the basic things you have to most of you already aware about that, but just go through this, because during your field visit or anyhow you people are going to interact with school children. So at that point of time, awareness will be very low from their side. So you have to use these kind of awareness things to make them not doing all these things. So what are all the do's and don'ts, which I'm going to explain in the upcoming slides. So these are all the basic things. Do not use medication in your ear without doctor's advice. Do not put anything in your ear. Do not use hairpins or some other instruments to equipments to clear clean the ear. Do not leave cotton wool in your ear, which will definitely damage your ear auditory canal and also tympanic membrane. Atif, are you there? Martin, can you please make Atif is Atif cannot able to share his screen or speak. So can you able to unmute?
Sorry.
So Atif is there from our team.
Oh, okay.
If you gave the permission to him, then he can able to.
Sure.
Yeah. Atif Anzar. Atif, now you can able to unmute yourself.
Yeah, now I'm able to unmute.
So can you please take over from here?
Yeah, sure. Mind?
Yeah.
Sure, Anil.
Yeah, I will come back within some.
Sure.
Thanks.
So Ranjit bhai, can you just will you share the screen or I should?
You can go on. I will stop the screen. Is it fine?
Okay. Sure. Right. Let me just give me a minute. Let me just share my screen. Is my screen visible?
Yes, it is.
So you have to start from this slide.
Right. Yes.
Sure. So thanks, Sanjay bhai, to cover all this point till now. So now we'll be discussing about the problems of the middle ear. The first disorder which we are going to discuss is otitis media. Okay. So otitis media, as you know, OT, we can divide this word into two words, like OT means ear and tis means infection, and media means middle. So it is the infection of a middle ear. So any infection of the mucous membrane lining of the middle ear is known as otitis media. Okay. So then there are two types of otitis media. So suppurative otitis media. So whenever you see this word suppurative, so it means there is some discharge coming out from your ear. And when the discharge will come, so it means there is a perforation in the eardrum. Okay. So perforation means there's a hole in the eardrum. Then only the discharge will be coming out. Okay. So this is of two type. One is acute and one is chronic. So if there is perforation in your ear and discharge is coming out, and it is less than or up to 14 days, so it is known as acute suppurative otitis media, or we call it in a short form as ASOM. When the discharge is coming out, there is a hole in the ear and it is more than 14 days, then it is known as a chronic suppurative otitis media. Okay. So, and then there are two more parts of this CSOM, which we'll be discussing in the further slides. So then we come on to otosclerosis and tympanosclerosis. So when there is a bony growth in the ossicles, the three bones, the malleus, incus, stapes, when there is bony growth or calcium formation, which leads to the disarticulation of those bones, then it is known as otosclerosis. Okay. And when there is calcium layer deposit or calcium layer formation on the tympanic membrane, the eardrum, so it is known as tympanosclerosis. Okay. So this is the difference between autosclerosis and tympanosclerosis. Autosclerosis, there's calcium layer formation or bony growth on the in the ossicles, the three tiny bones, uh, which amplify the sound and take the vibration to the cochlea. So when there is a calcium layer deposit or calcium layer formation or a bony growth, then it is known as autosclerosis. And when there is a calcium layer formation on the tympanic membrane, which is also known as eardrum, then it is known as tympanosclerosis. Okay. So is this clear? Any doubts? Okay. Then there are other disorders like tumors, disarticulation of ossicles, cancer, trauma. Disarticulation of ossicle means when there's disarticulation in the when the shape of these ossicles is a little bit disturbed, then it is known as disarticulation of ossicles. So now we are going to discuss this in detail. So let me just move to the. Okay. So first we'll be discussing about AOM, acute otitis media. So this is the initial stage of the infection. What happens? The mucus or the discharge, it starts accumulating behind the eardrum. So if medical intervention or treatment is provided at this step, so then it will not lead to ASM or CSM. Okay. So suppose if a patient is suffering from acute otitis media and like there is pain in the ear, bulginess is there, so it means that discharge is accumulating behind the tympanic membrane. And if the medical intervention is like he goes to the ENT and gets it treated, so it won't result in ASM or CSM. But if the treatment is not provided at this stage, so what happens? Like the discharge keeps on accumulating, and then there is a stage when like it keeps on pushing the eardrum. The bulginess is there, and it keeps on pushing, and then extent comes when it perforates the eardrum, and then discharge keeps coming out, and then it is like a hole is formed, and then it turns into the acute suppurative otitis media. Okay, ASM. So this is the like second stage, acute suppurative otitis media. So what happened over here? Like perforation is there, the discharge is also coming out, and it is up to 14 days or less than 14 days. Okay. If it is more than 14 days, then it will turn into chronic suppurative otitis media, which is also known as CSOM. Okay. So then there are two types of CSM, which is one is unsafe CSM and the other is safe CSM, which we'll be discussing in a further slide. So now in this slide, you can see like this is our normal tympanic membrane. Okay. Then this is the early, or we can say the initial stage where the infection starts. So the mucus or the discharge has started accumulating behind the tympanic membrane. Okay. Then it started increasing in quantity, and now it has started pushing the eardrum. So up to these two stage, if there is early detection of this AOM and treatment is provided, if the patient goes through the ENT, then further damages, like there will be no further damage. Okay. But if like medical intervention is not provided at this stage, then what it will do, this discharge, this mucus which is getting accumulated, it will keep on increasing, and then it will push this eardrum up to an extent when this perforation will happen, and then the discharge will come out of your ear and a hole will be formed. Now over here, this is stage, you can see now it has turned into ASM. Okay. So below this, you can see the images. Like over here, the eardrum, you can see it's red, inflamed. Okay. Then over here, you can see it has started popping out a bit. It has like started bulging, and then a later stage, a perforation has occurred because it was like pushing the discharge. Due to the discharge, so the eardrum was very bulged, and it has reached a stage where the perforation has occurred and the discharge has started coming out of the eardrum. So this is the stage of ASOM. Okay, let's move further. So now, like if it is more than 14 days, the discharge is there, uh, the perforation is there. So it is more than 14 days. So it is known as chronic suppurative otitis media. Over here, now you can see like sometimes what happens, the discharge keeps coming out, and if there's a stage where there is no discharge, or if the patient goes to the ENT, so might be the ENT is providing some medicines that stop the discharge. So then there is dry perforation. It means the hole is there in the eardrum, but there is no discharge coming out. Okay, so it is known as dry perforation. Okay, so now over here, now we'll be discussing about safe CSM and unsafe CSM. Okay, so now the difference between a safe and unsafe CSM, the main difference, these are the points which are highlighted, that in a safe CSM the discharge is profuse and odorless. Profuse mean the discharge is in large quantity and it is odorless, like there is no smell. But in unsafe, the discharge is scanty and foul smelling. There is a foul smell which comes out from the discharge. Okay, and it is like in small quantity, but the discharge is thick. Okay, then the perforation, the hole will be on the central part, which is also known as pars tensa. So in safe CSM, the hole will be on in the pars tensa, the central part of the eardrum, but in unsafe CSM, the hole will be at the attic or marginal site, which is also, we can say it on the pars flaccida. Okay, then if polyp is present, so in safe CSM, the polyp will be of pale color, and in unsafe CSM, the polyp will be of red and flashy color. Polyp are like grape-like structures, like skin growth, which are present in the confines of the eardrum and ear canal. So they are present in the ear canal. They are like grape-like structures, unwanted structures, which form a ring-like, okay, clusters. So if a polyp is there, so it will be of pale color in safe CSM, but it will be of red and flashy color in unsafe CSM, which is more an area of concern, which is more to bother. Then cholesteatoma. So in safe CSM, cholesteatoma is absent. In unsafe CSM, cholesteatoma is also present. So what is cholesteatoma? Cholesteatoma is abnormal skin growth behind the eardrum. When there is abnormal skin growth behind the eardrum, so it is known as cholesteatoma. So polyp is like between the ear canal and eardrum, but cholesteatoma, it happens like if cholesteatoma is there, it will be behind the eardrum when there is abnormal skin growth behind the eardrum. Okay, so in safe CSM, cholesteatoma is absent, while in unsafe CSM, cholesteatoma is also present. Okay, so in safe CSM, the complications are uncommon. Like you won't find much complications in comparison to unsafe CSM, where there are more complications. Okay, and if we talk about the audiogram, which is the report which we get after the PTA test is proton audiometry test is conducted. So in safe CSM, if there is hearing loss, so it will be mild to moderate. Conductive means like there will be problem in the outer or middle ear, which has caused the hearing loss. But in unsafe CSM, what happens? It can be conductive or mixed. Mixed means the problem can be in the inner ear also. Okay, caused which has caused the hearing loss. Okay, so these are the main differences between safe CSM and unsafe CSM. So unsafe CSM, if a patient is suffering from unsafe CSM, so I will suggest that he, like when you are diagnosing that patient, so you can say like medical intervention is necessary for a patient. Immediate medical attention is advised for a patient who is suffering from unsafe CSM. Okay, Like in safe CSM also it is necessary, but it is a stage where it can be delayed. But if a patient is suffering from unsafe CSM, so he requires immediate medical intervention, because if the patient is not getting any medical intervention, then it can lead to serious consequences. Okay. So let's move to the other slide. So these are the examples of safe CSM and unsafe CSM. So above are the images of safe CSM. So you can now clearly see the perforation is at the central part of the eardrum. Okay. Over here you can see in all the three images which are shown above, the perforation is at the central part, at the pars tensa. And in the case of unsafe CSM, you can see the perforation. The perforation is at the attic part or part flaccida. Over here, you can see the perforation is over here. In this image also, the perforation is over here. Okay, and over here you can see cholecystoma is present. That is the abnormal skin growth is there behind the eardrum. Okay, and in all the above images, you can see the perforation is there in the central part, in the pars tensa. Okay, so I hope this is clear. So we'll move to the next slide. So now we come to the disorder which is known as serous otitis media. Okay, it is also known as otitis media with effusion. Okay, so what happens in this? Like due to the improper function of the eustachian tube, okay, there is a presence of fluid in the middle ear. Okay, over here you can see behind the tympanic membrane, the fluid has accumulated, and this happens due to infection in the ear or improper function of the eustachian tube. Okay, so and this is very common. This disorder is very common in children. Okay, so what happens when they are suffering from cold? This disorder develops. There is a fluid formation in the middle ear space due to the improper function of the eustachian tube, which connects our middle ear to the opening of the nose. What happens then? What is the treatment for this? While you are in the field, so how you can diagnose? So you will see the bubble, like the fluid is there, and you can also like see the bubbles are behind the tympanic membrane. There might be some bubbles like this, or like this in the above images. You can clearly see there is fluid which has got accumulated in the middle ear space. Okay. So the procedure to treat this is known as myringotomy. Okay. So what happens in myringotomy? There is a small device called a grommet. So it is placed in the tympanic membrane. So it pierces the tympanic membrane. It's just like a pipe formation, and then the whole fluid comes out from this. Okay. So it makes a very small perforation. So when the whole fluid comes out of this, so this grommet automatically it comes out of the ear. Okay. So this whole procedure is known as, this is a minor procedure, and it is known as myringotomy. Okay. So then, as we already we previously also discussed about otosclerosis and tympanosclerosis. So like these two images are of tympanosclerosis. So as I told you, tympano means tympanic membrane, sclerosis means calcium layer formation. So over here you can see there is a calcium layer formation on the tympanic membrane. So this is known as tympanosclerosis. And when there will be a bony growth or calcium layer formation on the ossicles, that is these three bones, malleus, incus, stapes, it is known as otosclerosis. Over here you can see at the foot plate of the stapes there's a bony growth, and over here at the junction of the stapes a bony growth or calcium layer formation has occurred. Okay, This can also lead to hearing loss because the ossicle are not able to function properly and are not able to take the vibrations to the cochlea. Okay. So now we'll be discussing about the disorders of the inner ear. Okay. So the first disorder is Meniere disease. So what is Meniere disease? So in Meniere disease, like there's a sudden unilateral hearing loss. Unilateral means in one ear. Like if it is bilateral, it means in both the ears. Unilateral means in one ear. So there's a sudden unilateral hearing loss, like which is also characterized by sudden attacks of vertigo. Like you'll feel like vomiting. Tinnitus is there. Tinnitus means when there is a whistling sound or ringing bell-like sensation. So it is followed by a roaring tinnitus. The patient will not be able to recognize speech. He will face difficulty in speech recognition. There will be like violent spells of vertigo or vomiting. Okay, so in this Meniere disease, the hearing loss is also fluctuating. Like it keeps on fluctuating. Sometimes it's more, sometimes it is less, and it is gradually progressive in nature. Okay, so like there is no specified like treatment for this Meniere disease still discovered. Like there are few therapies like masking or use of hearing aid, which are suggested by the doctors so that it can get cured, but still there is no proper disease which you can say, no proper treatment which you can say can cure this Meniere disease. Okay. Then we'll come to the other disorder which is known as presbycusis. So presbycusis is simply when we have hearing loss due to advancing age. Okay, then it is known as presbycusis. When you have hearing loss due to advancing age, so it is known as presbycusis. Like just like we have hairs in our body, so as we grow, as we move on in our age, so they gradually fall. So that's like that. There are tiny hair cells in the cochlea. So when the age of a person increases, those tiny hair cells they also like gradually they start falling. So due to that, the electrical signals which are produced, they are less in quantity. So our hearing also gradually decreases. So presbycusis is like when you will suffer hearing loss, and that is due to your advancing age. Okay. So it usually begins at in early 60s for males and late 60s for females. So approximately 25% in age range 45 to 64 or 40% above 65 has some degree of hearing loss, and the treatment for this is hearing aid. Like how you can assess is like the person will not be able to recognize your speech, he'll face difficulty in speech recognition, and its management is done by hearing aids. Okay. So now we'll be moving to the other causes of hearing loss. So like CSM and ASM, like these two are not only the causes which can lead to hearing loss. There are several other causes also which can lead to hearing loss, like which is genetic. Sometimes the hearing impairment runs in the family, like the grandfather was also having hearing loss, then the father was having hearing loss, and it got transferred into the son also. So sometimes what happened due to diseases in pregnancy, like rubella, it's a type of measles, like other viral infection, this happens, or there are sexually transmitted diseases like syphilis. There are certain drugs which can also damage hearing while they are given in pregnancy. So then there are childhood diseases like measles, mumps, meningitis, etc., which can affect our hearing. Then there are ototoxic drugs, antibiotics such as streptomycin and gentamicin. If they are taken on a regular basis, so they can harm our hearing system. Also, like there are a few drugs, I like to give you example, like the drugs which are given in the treatment of tuberculosis. So they also have a lot of negative effect on our hearing. Okay. Then noise, uh, we all of us know, like if you are working in a noisy in a like those workers who are working in the industry where heavy machinery are used, which produce a lot of noise, like the decibel level is a lot there. So that leads to a hearing loss. Uh, like listening to loud music through earphones, like music explosions and all those things, accidents which may cause head injury or injury to the ear can lead to hearing loss. Then old age, okay, which we already discussed, like presbycusis. When we advance in our age, so gradually the hearing mechanism keeps on decreasing. Okay, so due to old age also hearing loss occur. Then wax, if there is impacted wax, like thick wax which is like covering your whole tympanic membrane, so the sound waves won't be able to pass through the ear canal in comparison if it is like the wax is not there. So it can also lead to a hearing loss because the sound waves will not be able to pass completely and reach the eardrum. So like those patients who are suffering from wax, impacted wax, when they get when they get their wax removed and you ask them now how you are feeling, they will say now it feels like it's we are listening better and our ear is like it just got more open, like so. Then glue ear uh, or cerosotitis media, it can lead to hearing impairment in children. Then consanguineous marriage between people who are closely related. Okay, or ear infections. Okay, ear infection can also cause hearing loss. Okay, so these were few many of the causes of hearing loss. Now we'll move to the next slide, which is type of hearing loss. Okay. So there are three types of hearing loss which depend on what part of your hearing is damaged. Okay. So like if you there is hearing loss and it is because there is some problem in the outer ear and middle ear, and due to that you are having hearing loss, so it is known as conductive hearing loss. Like you are having impacted wax or there is ASM or CSM, and due to that you are not able to hear, so it is known as conductive hearing loss. When there is damage in the inner ear, maybe the cochlea is not functioning properly, or there is some problem in the brain, in the pathway or the nerve which carries the sound signal to the brain. So if there is damage in the inner ear, so it is known as, and due to that there is hearing loss, so it is known as sensory neural hearing loss. If there is damage in both the outer, middle and inner ear, and due to that hearing loss is there, so it is known as mixed hearing loss. Okay, so these are the three types of hearing loss based on what part of your hearing is damaged, or in which part there is some disorders. Okay. Then this is the degree of hearing loss, as you all must be aware. So this you all will have to memorize this. So if a person is not able to, like we have this dB, decibel. So decibel is the unit of sound in which sound is measured. So if a person is not able to hear sound between 0 to 15 decibel, so we say it's a normal hearing. If he's not able to listen a sound between 16 to 25 decibel, then we are going to say like he's suffering from slight hearing loss. Okay. Then if he's not able to listen sounds which producing a level of 26 to 40 decibel, he's suffering from mild. Then 41 to 55 is moderate, 56 to 70 is moderately severe, 71 to 90 is severe, and more than 90 or more than 91 it's profound. it means like if a person is shouting at you, then also you are not able to listen. So you can say that a profound patient is a deaf patient. Okay, because he's not able to listen the sounds which are producing a level of 90 decibel. Okay. Then how can hearing be assessed? So for kids under 5 year, uh, we do a test which is known as BERA. It is brain stem evoked response audiometry. So, and in adults, we do a test called PTA, pure tone audiometry, to assess hearing loss. Uh, because like in BERA, what happens? Like why we do BERA in kids? Because in PTA, you need responses from a patient. Like the audiologist will be sending some sounds into your headphone, and then the patient need to respond. So the children below 5 years are not able to respond that properly. Okay, so then that is why we perform BERA in children, and the child must be in a state of sleep. Then only we can perform BERA on him. So BERA is costly also, and it requires a lot of time to perform BERA. The person should be in a state of sleep, then only we can do BERA. So that is why in adults we are doing this test called pure tone audiometry, which is done with the help of an audiometer. Okay, and the report which you get after performing this PTA is known as audiogram. Over here you can see this is an audiometer. Okay. So now we come to the pure tone audiometry assessment, like how we do it. So what we do, we take the sum of frequencies of 500, 1000, 2000, like the level of the threshold which we are getting, and then we divide it by 3, okay, to get the pure tone average. And then like suppose you got a patient is suffering from 28 dB hearing loss, so you can say it's a slight, he's suffering from a slight hearing loss. Or if the hearing loss is suppose 85 decibel, then you can say this person is suffering a hearing loss which is like a severe hearing loss. Okay, so like this you can assess the hearing loss. So this is the hearing loss we perform through our ENTraview. Okay, screening of hearing loss. With the help of ENTraview, while we are doing, so we are assessing them through like air conduction mode. Like there are two ways we are hearing. One is air conduction, when we hear through this normal process, when the sound waves are entering our ear canal and going to eardrum. That process, if we are hearing like that, it is known as air conduction. When we are hearing through our mastoid bone, so it is known as bone conduction. So our hearing test which we do in ENTraview, so it is like it only checks the patient on air conduction mode. Okay, so these are the screening steps, like to check on the patient complaints, what he's facing, like whether diminished hearing, whether he's facing tinnitus or not, tympanic membrane. So you need to check all these things when you are going to conduct a hearing test. So if he's suffering from all these symptoms, then you will be doing a ear screening test for him. The other instruction are like make them sit on a comfortable place, tell them to be relaxed. Then audiology screening, a place should be separate from otology screening, because there should be less, like this test can be performed only when there is less surrounding noise. Okay, to get better results. Like we all told you, when the signals are in green and yellow, it should not be in red when you're performing it through that fit to go app. Then you need to explain the test to the patient. Headphone will be placed on your ear, and the wired side will be on the left side. You will hear pure tones in both the ears by one by one. Okay, first it will go into the left ear, then in the right ear, and you will test the patient on different frequencies. So you'll ask the patient, you need to respond accordingly. Then you need to raise hand whenever you hear those tones, you need to respond to the softest sound as well. Okay. So this is the process of test detailed procedure, like step size, like you'll be increasing and decreasing as I told you, like one by one, and then you'll be asking the patient about the response. Then we'll be discussing about the treatment of hearing loss. Okay. So hearing loss can be treated, as we all know, by using hearing aids. Okay. So these are the types of hearing aid. You can see this is invisible in the ear. This is a CIC completely in the ear, then ITC in the ear, and then these are behind the ear. Okay. So these all are like there are like different sound levels. Like if a patient is suffering having a more hearing loss or suffering from profound hearing loss, then we generally provide them with the BT behind the ear, because this the hearing range is more. Okay. The fitting range is more in these hearing aid as in comparison to the uh, mini range or this invisible in the canal range. Then these are some basic parts of the hearing aid. You can see this volume control button. This is the program button, battery hatch is there. Then amplifier, microphone. So what does the microphone does? The microphone catches the sound. It catches the sound, and then the sound goes to the amplifier, which make the sound more louder. Okay, which amplify the sound, and then that sound is transferred to the receiver, which sends it to the ear. And so this is the basic parts of the hearing aid. Then benefits of hearing aid, as we all know, one can hear better, the quality of life gets improved, ability to communicate and understand is improved, ability to learn home, school or workplace is improved. So hearing aids help the hearing impaired people to interact with their family members, community. Okay. So shall we stop for 5 minutes, and then we can continue with this device training and hands-on.
Okay.
Ranjit bhai?
Okay.
Yeah.
Okay.
So we can restart by 3:50.
Yeah,
Is it
sure.
fine, Martin?
Okay, fine. Okay.
Sure, Faisal. Thank you.
We can restart at 3:50.
Okay, thank you. 3:50. Atif, we can start by 3:50, right?
Sure, sure.
Okay, thanks.
Okay, welcome back everyone. We can start, Ranjit.
Sure, we can start. Sure. Atif.
Okay, so let's start. So now, as you all are familiar with this interview, so you need to like wherever you are going to do the screening in a camp or you're going for a door-to-door screening, you need to place the interview like this. Okay, on the top one, which is provided in the kit bag, because uh, this part you are seeing, this is the lens assembly part, this whole part. So this is the lens assembly part. This contains the camera, the lens, and the optical fiber. So this is the most costliest. This is the costliest part of this whole device. So if you are keeping it like without a speculum from this side, so it can lead to the damage in the lens assembly. Okay, so you need to always keep it as shown in the image. Okay, and there should be speculum should always be there in the device. Okay, you should never place the device without the speculum. So you need to check if the speculum is present or not. You need to ensure, like before going in the field, whether there is any physical damage or out of the box defect. If it is there, you need to report to your reporting manager, like, okay, you need to escalate the issue if there is any damage. Okay, then the next step is doing an LED light check. Okay, so there are four intensities. So the first time you will be switching it on, so the highest intensity will be there, and every time you will be pressing it, the LED intensity will fall. So once all four intensities are checked, so ensure that LED you are switching it off like before logging in. Okay, so this is done to save the battery whenever you are doing screening in field also. So when you are screening 1 year and then just marking the provisional diagnosis, so you need to switch it off because LED consumes a lot of battery. Okay, so this thing you need to take care of while doing the screening in the field. Then switching it on. So as we all explained, like when we are in person, so you need to switch it on like this, because the volume, the power on and volume down button, they are very near to. So if they both are pressed, then the device goes into the recovery mode. Okay, so that is why you need to switch it on like this. And if in case it goes in to the recovery mode, then you need to press this volume plus button to come out from that recovery mode. Okay, so this like in our smartphones, so you need to press this volume plus button, and then this will come out of the recovery mode. Then holding the device, you need to hold the device as it is mentioned, as you can see in image B also. Okay, so while using the workflow, you can hold it like this. While you're doing the screening, you need to hold it like this for a better grip. Okay, then you need to enter the 4-digit password and then press enter, like which is 1234. Then you'll press this enter button to unlock the device. Then if you are using the device for the first time, then you need to register the device. You will mention the identifier, and then you will mention it again, and then you will submit. Okay, so then there are okay, you will find that identifier, the serial number over here, uh, where Medtronic is written below it, the serial number will be there. So you need to just enter it 2 times and then submit. This is when you are using the device first time. Then there will be some login IDs which are created. You will be provided some the login IDs and password. You need to enter those login IDs, the username and password, and then log in through that. So remember that you are not putting it again and again. You are not putting the wrong password, because what will happen, like if you are putting the wrong password 5 times, then your ID will get blocked for 24 hours. So you won't be able to use the device for 24 hours. So it is better, like if you're not able to remember the password and 1 or 2 times you have put the wrong password, so it is better to uh, escalate this issue to ask your reporting manager about the IDs or the password that I have forgotten, instead of like entering wrong password again and again. Then you need to enter the 5-digit passcode, which is like 12344. You need to confirm it, and now you'll come to this page. Okay, this home page. So when you click this icon, your profile will come. Okay, which will include your first name, the profile of the person who is using the device, whom the device is assigned. So your first name, last name, gender, phone number, the site location where you are operating, all these things will come. In case you need to change it, you can go to this and you can change. Okay. Then we come to this page. Like if you want to change your password, so you need to enter your old password, then you'll put your new password and confirm the new password once, and then you can change the password. So you don't have to change the password by your own. You, if there are any instructions from your reporting manager, then only you need to change it. Like without that, you don't need to change the password on your own. Now, after that, this on this page, you can see, uh, Ranjit bhai, is my screen visible properly, or like I need to zoom?
It is visible, but if you zoom a bit, then
Sure, sure.
people can see.
So is it fine now?
Yeah, this is fine. This is fine.
Okay. So like over here, you on this page, you can see monthly screening is written. So you can see the monthly screenings which are done. Then whatever screenings you have performed on that particular day, like a screening today, that can also be seen. And what is the average time taken to do all these screening, you can see over here, like 1.82 minutes have been taken to screen. Okay. So after that, like you will press on this plus icon, yellow icon, to create an event. Suppose you are doing a camp at a community center, like in Kollam. So you need to write add event. Then there will be an option whether it is camp or door to door. You will write camp, whatever it is. Then the location. Suppose you wrote it down community center, then address, city, then the pin code and all those things. Then it will be asking whether it is a free camp or paid. Like if it is free, you need to mark this free. If it's paid, you need to write paid, and then it will ask you like what's the amount. You need to enter the amount, and then you can submit it. So what happens, this will create an event. Okay. And then you will keep adding the patient into this event. So then if the like telecounselor is accessing the web portal, so he will like by looking at this only, he will analyze like these patients are from a particular camp. Okay. So now you have created the cam, and now you need to add the patient in that cam. So you can see a plus sign on the top blue bar. So at the top right corner you can see this. So you need to press this button. Then a patient consent will come. Okay, so you need to there are two times, like in the form there are two times the patient consent will come. Over here you have to tell the patient orally, like you have to take permission, like we can screen the ear, your ear or not, so that uh, there is no problem after that. Like if there problem occurs, so the patient can't blame you, like you have done like he was not allowing you to do, but still you did it forcefully. So that is why taking consent is very necessary. So in start you take permission only, and then in the end we take digital signatures.
അപ്പം അതിനോണ്ട് ഞാൻ സമ്മതിക്കില്ല. എന്നുവെച്ചാൽ 85 ദിവസം ആയിട്ട് അല്ലാത്ത ധൃതി ഒരു പ്രൈവറ്റിൽ എടുത്തോളാൻ പറയും.
uh, uh, Please keep yourself on mute. Thank you. So after taking the consent, you will press this yellow arrow. So then this patient complaints page will appear. Okay, so over here you can see there are complaints mentioned: ear pain, ear discharge, itching. So you'll be asking the patient like whether he's suffering from ear pain, ear discharge, itching problem is there, diminished hearing, ringing in the ear, or there are any other complaint. And suppose if the patient says like he's suffering from ear pain, so then in the next page it will be asking like he's suffering from ear pain, so it is in which ear, right ear or left ear, or both the ears. Then the duration of that ear pain, whether it is from more than 1 week, less than 1 week, between 1 to 3 months, between 3 to 1 year, or more than that. Like just like when we visit a doctor and we are telling the doctor about our problem, so the doctor asks us like you are suffering this problem from how many days. So just like that only, we need to ask the patient complaint and fill, so that all these things help us in the provisional diagnosis of the patient. Okay. Suppose the patient is saying like he's suffering from discharge, then you will be asking in which ear. He says right ear. Then you'll be asking the duration. He says it's more than 1 month. So now you can assess like the patient is saying discharge is coming out. So it means there must be a hole in the eardrum. Then only discharge is coming out. And he's saying that it is from more than 1 month. Then it is CSOM. So you can analyze like this by keeping the patient like while marking the provisional diagnosis, you need to keep all these patient complaints in your mind. So they help us a lot in giving the provisional diagnosis to the patient. Okay. Then this is a normal eardrum picture. So this is the way you need to take the picture, so that the whole pars tensa, pars flaccida, and some part of the ear canal are is present. Okay. So when you will be taking the image, you will be reviewing it on the screen whether you have taken the image in a correct way or not. If not, you can take it again. Okay, you can discard that image and take it again. If you are like if you're taking the image again and it is fine, then you can click on done, and then click on the camera icon to take another image. Okay. So when you will be using the device for the first time, so you'll have to like align the camera, do the alignment. What you have to do, you have to just enter this red circle in the middle of this area, and then the alignment will happen. You can press this button, and then when you are taking the images, you have to press this yellow camera icon to take the image. So you need to take one image of both the ears. Okay, to move ahead. So after capturing the picture of the tympanic membrane, so this page is displayed like left ear, right ear. Okay. So click on the images if you want to check and then you need to press this arrow button to move forward to proceed. Now after like clicking the images, so you have to mark the abnormalities what you saw in the images. If there are any abnormalities, so you'll be marking those abnormalities. Like if there is no abnormality, you will mark this option none of the above. Okay. If there is any abnormality, so you will be marking that. Suppose uh, there is some deformity in the pinna, a patient is suffering from perichondritis, you will be marking abnormalities in the pinna. If there is like perforation here in the eardrum, a patient is suffering from ASM or CSM, you'll be marking it. In the tympanic membrane, if there is wax buildup in the ear canal, you will be marking in the external auditory canal. So after marking the abnormalities, you will proceed again by pressing this yellow arrow, sorry, blue arrow, and then this page will appear. So suppose there was wax in the ear canal, so then you'll be marking in which ear it was, right or left. Okay, and after marking that, you will press the OK button. Then based on the patient's interest to take the treatment, you will be marking the priority, whether it is high, medium or low. So suppose the patient is very interested to go for the treatment, you'll mark it as high. If he's somewhat interested, you'll mark it medium. And if you think the patient is very least interested to take the treatment, you'll mark it low. So this helps when the our telecaller is sitting to call the patient, so you can filter the patient based on the priority on the web portal. Okay. So then you need to mark at the end, you need to mark the provisional diagnosis. You need to select the appropriate disease. Then the app will automatically ask like which year. Then you can select left, right or both based on what you saw. Okay. Then you'll go to the provisional diagnosis page. Okay. Select or deselect the diagnosis. If there is no disease, you will select none of the above, and then you will tap and go for the next page, and then you need to take the consent. This part is very important. Okay, you need to take the digital signatures of the patient. Sometimes what happen, like due to hurry, the ECs or the health workers, they mark themselves, they do the signature and press submit. So you don't need to do it this way. Okay, because this is one of the most important step. So you need to ask the patient to sign it digitally, take the digital consent, and then you need to move forward. And now at the end, you can see this summary page. Okay, where you can see the whole provisional diagnosis, the priorities there. Okay, the your findings are also there. So if the person is suffering from any abnormalities, you will press on the print icon and give him the slip which is generated from the Bluetooth printer. And if it is not suffering from any disease, so you can mark it submit. Okay. So this is like this. You can see this is the slip is there. Like this, you will get a slip which is given to the patient. Okay. So the patient then can take the slip to the center and get the treatment done. So after you have done all the screenings in the camp, so you need to upload all the cases, all the patient cases which you have done the whole day. So for that, you need to just go to this upload option at the bottom of the page. Over here, you can see this upload option. So you need to go to this upload option, then upload all option will come. So you can connect the device with the internet using the SIM card or the Wi-Fi, if Wi-Fi is available, or you can connect your mobile hotspot, because the cases are like of in just KBs, so it takes only 1 or 2 minutes to upload all the cases. So you will then press this upload all option, and then all the cases will get uploaded, and then this like red pop-up will disappear. If there is any red pop-up or notification or on this upload option, it means there are some cases which are still left to be uploaded. So if you are pressing on this upload all and all the cases get upload, this red icon, this will disappear. Okay. So you can only create 3 events max in a day, because not like it's also not possible to do more than 3 camps in a day based on the device battery usage.
Atif,
Sure, I will show the
yeah,
slide which
okay, sure.
mentions about the setting of the camera. Yes. So this you have to perform the alignment when you're using the device for the first time, or like you have logged out from the device. So then you will be doing it. Once you have done the alignment, so you don't need to perform this again and again. So if you are doing the first time, so you need to do this image alignment. What you need to do this, you just need to place this red circle in the middle of this square box, and then you can press on this option which you are seeing, then it will get aligned, and then you can use this camera icon. By if you want to click the ear image, you can press this yellow camera icon. So this needs to be done when you're using the device for the first time, or you're logged out, and then it will again ask for the to set the alignment. Otherwise it won't be asking you. Okay, now is this clear? So Ranjit bhai, shall we move
Yeah,
forward?
yes. So team, there are some slight changes between Shruti app and also Shalabam app. So basically, the Shruti app will cover all the steps and the flow of the Shalabam app. But there are some initial and also the end slides variations are there. So once we start doing the screening in the field, then we can able to understand what are the changes. But that is not a major changes, which I will explain you later or during our physical present in the sites. Yeah, if you can go on.
Sure. So as we are on this slide, so we can't create more than 3 events. So like you won't get permission for creating more than 3 events, because it is not possible also to do camps at like 3 places in a day. No, there is no problem if it appears occasionally while using the app. Like if it is coming occasionally, so you can set the alignment. It won't come occasionally. When you log out, then only it will appear. Like then only it will ask you to do the alignment, or if you are using the device for the first time, then only. Otherwise, it won't appear occasionally. And if it is appearing, you just need to set the alignment, and then you can use. It doesn't mean like it is a problem. If it is appearing like again and again when you are using, then you can escalate it. Okay, otherwise it's not a problem. So you can also delete or edit an event. Suppose you need want to change the name of an event, you can go at that page, you can change it, you can edit it. You want to delete an event, you can delete it. Like you need to go and select the camp, and then option will come. So you need you can delete it also. Okay, so maximum 3 events are allowed per day. Okay, so use there is one condition, like a user cannot delete an event if it contains any patient case. Okay, suppose you have created three events in a day, like while you are going to start the day, you just created three events, like you had in mind like you will be doing the camp, but what happened, you only did camp at two places, so the third place has no patients in that event, so you can delete that third event which you created. But suppose you had added the patient in that third event also, then you won't be able to delete that event. Okay, if there is no patient added in that event, you will be able to delete, but if you have added a patient, then you won't be able to delete. There is no need to log out from the app after using. Yeah, you can keep it login on only. Like if there is a change of the person who is using the device and you need to change all those details, then only you can log it out. Otherwise you can keep it login. If one person is using, there is no problem, keep it login.
Okay,
Ranjit bhai, correct me if there is any like.
Yeah, you are right. You are right. So no need to log out and all. So if there is any problem with any other device and there is some situation happen that we are going to use one device for the other one, then based like after getting the approval from your manager, you can perform the logout and login process. Till the time, no need to log out and all. You after completing the screening process and also upload by connecting the internet, then you have to press the home button and switch it off, keep it in charge. By tomorrow you can get the device and switch on, and as usual you can select the Shalabha map and you can start your screening process. This is the routine process that you are going to do on regular basis. No need to log out and
Yeah,
all.
so the process is same in the Shalabha app and in our app. Thanks Sanjit bhai for adding.
Sure.
So in case you you have forgotten your password, so it will when you will press this forgot your password option, so it will redirect you to the page to change the password. So now over here you need to enter the new password and then confirm the password, and then you can press on this change passwords. So then you need to also follow the like instruction, minimum 7 characters are required. It should contain both letters and numbers. So you'll be asking your reporting manager about that, and then you can like change the password and all those details.
one more doubt I have. Hello.
Yes, yes.
While charging, should we switch it on the machine or switch it off in off mode? In what condition we have to maintain while charging?
Like if you have used the device, so you can switch it off and place it on charging, and then when you are going for the screening on the next day, you can put it on.
Okay.
Like if you are doing the charging while placing the device on mode, it's not a problem, but when you're not using it, then you can simply switch it off, and when you come to use it the other day, you can switch it on.
So there is no problem while if we are it is in the on mode or in the off mode also.
Yes,
Okay.
but it's better like if you have used the device, so it's better to switch it off and then place it on charging mode, and then you can put it on. But there is no problem like if the device, the battery is low and then you are putting it on charging.
So the charge is not getting for not even 3 days. Even if we are not using the device, also charge is getting drained out soon. So that's why I asked, is there any problem if we are switching on the device and charging like that.
Yeah,
That's why.
actually that there are two batteries in this device. One is that LED battery which is at the present when where the handle is there, and one is a mobile battery. So just like when we are using mobile, suppose right now my mobile battery is 65%, I will switch it off, and after 3-4 days when I will switch my mobile on, the battery will remain constant. It will again show the battery 65%. So same is the case with the device. Like if you will switch it off at 60% and switch it on after 3-4 days, the battery will remain 60%. But what happens? That LED battery, that deteriorates, that diminishes, that doesn't remain the same. So if you are going for a camp, you need to charge the device again, so that both the LED batteries and mobile batteries get charged. The mobile battery will remain same, but if you are not using the device for 3 to 4 days, that LED battery that will drain out.
Okay, okay.
Okay.
Hmm.
Thanks. So then if you the two users are using the device, so what you need to do, you need just to log out, and then by using the credentials of the other user, you can sign in as a different user. You need to put that a different username and the password. Like if two people are using the device and there is like SOP or criteria for
So
them.
you can do that once after getting the approval from your manager.
Yeah. So you can take the approval, and this can happen if like two person are using one device. So you can put on the username and password, because that you will be getting from your manager only. Uh, so you can just put the username and password and log in into the device. Then there are some points to remember, like to print the slip, you need to turn the Bluetooth printer and connect it with your ENTraview device, just as we connect while we are like suppose we are connecting our mobiles with our headphones, like that only. You need to just switch it on the Bluetooth in your ENTraview device, and then switch it on the Bluetooth printer, and then when you'll go in the search option where search Bluetooth devices comes in, you'll need to go into the settings, and then there will be options search Bluetooth devices nearby. There you can find the printer's name, ESBA, and then you need to just click on that and it will automatically pair. Okay. Then as I earlier told you, no need to enter wrong password more than 5 times. Otherwise your ID will get blocked for 24 hours. Suppose you are going for a camp, you need you need to operate the device in the camp, and you have entered the wrong password 2 to 3 times. Then no need to do it again and again, because then it will, your ID will get blocked, and then you won't be able to use that device in the camp. So it's better, if you are not able to remember, just ask your manager about, escalate the issue, ask your manager about the ID and the password, so that you are able to use the device. If you'll enter again wrong information, you'll enter 5 times, so that will get blocked and you won't be able to use the device for that day. Okay. Then there is no need to use ENT capture or ENT setting app for image setting. Like there is you will find these two apps, so no need to use these app. Image alignment is present inside the app only. You can print the slip for referral as well as normal patient, so as directed by your manager. User can print the slip even after submitting the case. Also you can go and print the slip in the cases list. Then priority should be marked as high, medium, low based on the interest of the patient to take the treatment or to visit the hospital for the treatment. Okay. Ranjit bhai, if you like to update on this Shalabam ID integration.
So that we will provide it to managers only, that we can do during our field visit or center visit, Atif.
Sure, sure. So I've covered till this. So do we need to cover something more, or like if there are any doubts, so we can address
So this
that.
is fine. We can go to question and answer session.
Yeah.